Holistic program, so this is about treatment, it's also about prevention. You need to look at these things in the round, and that's clearly part of the debate, thinking about the next 10 years, and we've seen some of the very good thoughts there. The generic industry and the innovative industry both contribute in different ways. The innovative industry has been responsible for a great majority of the innovations we've seen. They've been responsible for the lower prices in markets where we haven't seen generics. But in lowest income countries, obviously the development of the Indian generic supply has been a significant factor, and domestic generic companies in some countries as well. Innovative companies clearly are competing both on new medicines. They're also competing with each other on access programs. That's brought some complication in terms of what is on offer in different markets, but that brings some benefits as well. Competing on providing access in different markets has brought great benefits. It has brought some problems in terms of complexity, and clearly we need to work to make sure that countries know what schemes are actually available and know what prices are. Price structures are existing on the market. IP, where it's clearly the case that the existing IP regimes in middle-income countries mean they won't get the same price as the lowest-income countries, and generics bring lower prices in those markets. That is just the current structure of the market we have. This will clearly develop in the future years for second-line treatments, but it is inevitable to some degree that these markets will mature and generics will come in. And this is a part of evolution that we've seen just as we saw for first-line medicines. So many other challenges clearly remain. There is a large unserved population. We talked here about 50% using the 2006, clearly a great proportion using the 2010, and there are particular patient groups where there's work to be done. But there have been huge achievements through all of the stakeholders involved in this process, the innovative industry and the generic industry, and donors and local governments, and particularly NGOs, prompting the political climate that allows access to occur to any extent in the first place. So there's a great deal of credit to be dispensed in terms of understanding this, but there's also concern. This is a therapy area and a disease that mutates. There is a need for continual evolution in terms of innovation. And I think in some of Brenda's work we talk about the dynamics of the generic industry and some of the concerns there. We also do need to bear in mind the dynamics of the innovative industry, and both of these need to be taken into account in thinking about how these implications feed into the debate for the next 10 years. Thank you.